Thank you. My name's Sandra Brackert. I'm the nurse practitioner with the Sarcoma program, and I just want to thank Annie and Dr. Shea for motivating us to have this talk, educational forum today. They approached Dr. Singh, and he approached all of our team, and as you see, we're a very collaborative team, and we're very fortunate at UCLA that we have top experts in surgery, surgical oncology, I should say, radiation oncology, nutrition, and medical oncology. And we all work together. And my talk, I'm not going to do a PowerPoint. My intention is to get more of a collaboration with all of you, because I think the special part of having a day like this is you being here. And as you see and as you know, we are experts in our certain fields, but you are the individual expert in this disease. You're the one that lives with it every day or takes care of someone that has it. And we learn from you and we learn from each other. And I really would like if you could just take a moment, maybe even close your eyes, and just kind of have a mindful moment of what leiomyosarcoma means to you. And really just close your eyes and reflect on that. I really want to give you just a few seconds or a minute to really ingest what is leiomyosarcoma. And I would really like it if someone would just raise their hand, and I'll pick on people, and maybe you could just share whether you're living with it, whether you're newly diagnosed, whether you've gone through treatment. I mean, we're all at different stages. So besides being a unique diagnosis, we're all in unique stages of dealing with it and living with it. And I would appreciate if anyone willing to just raise their hand and share what came up when you thought to yourself, what is leiomyosarcoma to me? Yes, please.
I was going to say for me, at least.
And can everyone hear her?
I was going to say for me, and living with my brother as his caretaker, with someone who's had it for 15 years, it's a real lesson in perseverance and attitude. And I think the longevity of the span that he's dealt with it is heroic to me. As you went through the slides, pretty much all the boxes were checked from what he's gone through. And I speak for him because he's the quiet, silent type. We're opposites in the family. But yeah, I would say a lesson in perseverance, and it's something, of course, we knew nothing about until 15 years ago when he came home and said this is what he had.
Thank you. Thank you for sharing. Yes.
When I was first diagnosed, I went right home and went to the computer and found out my statistics were not looking too good. And I thought, well, in some ways, that's a certain way of knowing that that's how you're going to go, unless, of course, something happens before the leiomyosarcoma takes you. And I can only say that the love I have felt from family and friends and anybody who knows that someday I'll be gone is amazing. So it's a great time to pull all of that in and know that your life has been worth something to so many people. And I'm really very comfortable with the idea of going that way. It is my destiny until we get a cure. And I'm making the most of every day and trying to feel as good as I can. And someday there will be better therapies, things that are not so toxic and invasive. And it's just not going to probably be in my lifetime. And I'm all right with that.
Can I
And
just
I
ask?
think it's an inspiration for people that are around me in some weird way.
Yeah.
So,
Can I just ask you how long ago were you diagnosed?
2 years ago.
Very good.
Based on that, I'd like to add that I was diagnosed a year and a half ago, and the care and treatment that I've gotten has just been amazing, beyond words. But I also belong to a support group, the Benjamin Center that nice lady was talking about earlier. And last Thursday at my meeting, something came up about cancer, and I spoke to the group about how my mom died of cancer. And just since Thursday, the reflection has been the difference between how cancer was treated and what my mom had to go through, and the difference for me, how much gentler and more loving my road has been. And a lot of it is because of this group, UCLA, and just all the work that people have done since then to now to make our roads easier.
Anybody else?
I was diagnosed a little over 3 years ago. Had a couple of surgeries. But, when I initially was diagnosed, I thought, gosh, cancer sounds so terminal. And my initial reaction, my initial concern is that, my God, nobody in my family knows my business. So my concern was them instead of me. And like a couple of you have already indicated, is that it is amazing how the family support function is so important in dealing with what you're going through. And they often ask me, how can you be so calm about it? I said, well, I have two options. It's either laugh or cry. And I don't wish to walk around with an acronym again. The important part to me, again, is the family support. And I guess I have a very large family, 12 brothers and sisters. And they all have a tendency to want to come by and bring me food. So, so I tease them and I say, yeah, Meals on Wheels is here, But it's been a ride, but it's nothing that difficult because of the family.
Great. Great to have that. Anybody else? I appreciate the sharing because I think we do all learn from each other. And especially when we go out to lunch, you might take the opportunity to meet other people. And like I said, even though each of us, or each of you, I should say, are at different stages and different experiences, there is a special bond that you have. We are all very passionate about being with the sarcoma program here. And we're, as you see from our talks, we're looking at new research and new treatments, and we want to beat this. But for right now, we're working with the best that we have. And I think learning from each other and how to deal or cope, whether it's asking family to bring meals or transportation to an appointment, going to support groups. I look out at the audience and there's people here from the pharmaceutical companies. And they're here today because they're passionate about providing drugs and new drugs and helping with the side effects of these drugs. And everyone that's here today is here because we're passionate and we want to, I guess, share that passion with each other, right? To make it easier for each of us and each of you. So I appreciate that if anyone else would like to share, we have time, just to, yes, Chris.
Well, I have to agree kind of with both of those last two people. My father had cancer in the 70s, and my sister, and he died pretty young. And my sister died very young, breast cancer in the 90s. And after my diagnosis, which was about 3.5 years ago, my inclination was to not even bother with chemotherapy, because they just were violently ill with the drugs that they were taking there. And extremely uncomfortable with the radiation and all of those things that they have to deal with. And I'm very glad, being here 3.5 years later, that I decided to find Dr. Singh and start the therapy, because I've been minimally sick, just a few times. I mean, there's nausea, weak and solid and stuff that goes along with it, but I can still live, I can still do things, get out, and I can be with my family, and I think that leads me to the next thing. I have an unbelievably wonderful family. Wife is here with me, and my daughter. Been a great support. So you find out a lot about the people that that really care about you. You also find out what you can handle, and how you can kind of overcome the terror of the original diagnosis.
How many people here are patients? So kind of look around and see, because I've heard comments, oh, it doesn't look like they have chemo, or, they've had surgery or radiation, and just about everybody here that's a patient has had at least 1, 2, or all 3 of the modalities. At least once, twice, who knows, what stage. And then we have people that are scared to start, and maybe you could talk to people that have gone through it and get some inspiration from them. And then how many people here are caregivers? And I always say it's sometimes, harder for the caregivers in certain ways. And not to take away from what's going on with you, but it's hard for the person on the outside that wants to fix everything or make everything better or control things that really aren't in anybody's control. And it's a very difficult place to be for them. And so that they persevere as well. And yes,
Oh, sorry.
please, just share if you'd like.
I was going to be the voice for my friend.
Yeah.
Who has experienced this and felt that she wanted me to share.
Yeah.
But for one, to inspire some of the people who have been diagnosed more recently. My friend was diagnosed, I think 6 or 7 years ago. And she is a true inspiration. I mean, in the beginning I thought maybe she wasn't being realistic, but then I learned a lot, because I believe that the mind plays an important part, and the doctors, and of course, and Dr. Shimoski is such a supportive, amazing person, because I also had an experience where my younger brother didn't have that kind of experience when he had cancer. I wasn't prepared for this, by the way. And I don't want to get emotional or talk about my experience. It's just that I'm so glad that my friend, and you, Sandra, have been very supportive of my friend. But she also has believed from the beginning, and I'm not saying it's just your mind, because obviously the treatments have made it. But, everyone is unique, and everyone's immune system is different, and that's why someday immunotherapy will hopefully get rid of HIV and cancer. Our own immune system, I guess, to fight it. It's good to I guess, have this positive outlook that she has and hasn't looked at numbers like I had this time, because it doesn't have to be that way.
And we can't look at numbers, can we?
Sorry?
We can't really look at numbers with this
No, and
diagnosis.
also giving hope, like what my brother didn't get. Yeah. Is he didn't get the hope. He was given, a number, and I think it's, doctors like Dr. Trinaski make a difference because we're not God. No one is. No one knows, really. And we can do studies, and there are studies, but everyone is different. That's all.
Thank you.
I just want to thank from myself and everybody else here, I think, the staff at UCLA, Dr. Chomlowski, Sandra Brackert, and everybody else. I remember 2 years ago when my wife was going through chemo and she developed the infection after that. I called Dr. Chomlowski 2 o'clock in the morning and he answered it himself. So I called 2 o'clock in the morning himself, and that's just shows the dedication that the staff has here to the patient and trying to solve this in one day. Thank you very much.
Anybody else? Yes.
I'm just thankful that I came from another provider, and they had surgery, I'm here for a second surgery. And I had already figured out one of the best surgeons in the business. I already had it figured out, and I called up, got in right away, and for him to overturn, I was already prepping for the other surgery. For him to overturn, and he went out to the whole team. A number of people looked at the same radiology report, and I just thought that was amazing. Because you always hear when doctors stick together and they don't. And not that it was any hit against my other doctor, but they weren't specialized in this area. So at that moment, I just said, oh my goodness. Oh, he was quite happy because he says, I don't get very many opportunities to get good news. But in your case, there's no surgery, there's nothing to be done. So I'm just really thankful for that, because that takes a lot of strength for the whole team to fight up against.
Sharon?
Well, I don't know, I was just thinking, when you ask what does it mean, what does LMS mean to me? I guess, like, I was diagnosed almost 3 years ago, and I guess I'm finally at the point where I can see blessings from having this disease. And I know when you're first diagnosed, you're like, that's like ridiculous. But, my husband and I have a lot of faith, and I definitely can see little miracles along the way. I mean, just the fact that we have found the UCLA Sarcoma program to treat, that we live close enough to treat with you. The family and friends that love and help us along the way. There have been blessings, Anyway. I always try to tell myself I never wanted to be a grumpy oncology patient. Hopefully I'm not most of the time. So anyway, we're just grateful for, there are little blessings along the way, you just have to look for them because they're there.
Anyone else feel that way?
And another thing I'll add is that we've gotten notice. We're lucky. We weren't killed in a car accident yesterday. So it gives you preparation, it gives you time to prepare, say your goodbyes. This isn't one of those, most people don't die within 5 months or something. It's a little bit more prolonged, and that's the gift. Time to prepare and time to take care of our business.
Is there anybody else that would like to share? Go ahead.
Yeah, I'd just like to say that I was diagnosed 16 years ago. stage 4. It was in my leg and went in my lungs. And my first oncologist suggested pretty strongly that chemo was worth the effort. And then I went and got a second opinion at a sarcoma center. And went back and forth, and I decided at least to go to war with this disease. And so I had a lot of surgeries. I'm not saying it didn't come back. It can't come back about 6 times. And it was in my lungs to start out with, so it started in my leg. So, I've probably grown from the whole experience, and so has my family. They're all a testament to what I've gone through. And I just say that sometimes you just have to step up and try the best you can and learn as much as you can like we're doing today. And one more thing is that I was a racquetball player, but a pretty good racquetball player. Yeah. But when I had the surgery, they took a lot of my leg away after 5 surgeries. And I did have radiation, hyperbaric chamber to heal the wound. And even today, I still have a wound that's not healed, 16 years later. But 3 years ago, I won the world championship in 65-year-olds and higher, and come in second in doubles.
Wow. So I think it's lunchtime. I just want to close with one statement. Why are we in sarcoma? Why did we choose sarcoma? Why are pharmaceutical companies working on drugs for sarcoma? It's why did you get sarcoma? I think that's the other question everyone says. Why did I get this? And I don't know why you got sarcoma. All I do know is that the people that get sarcoma are the most special people that I've ever treated, that I've ever taken care of, that I've ever met. So you all should meet each other while you can, because you're a very, very special group. Not just because you have a rare, unique cancer, but because you are very beautiful, very special people, and dealing with a lot. And, I can't even imagine all that you are living with. But somehow this disease has affected the best people. And I'm sorry for that, but that's what I see. And that's why we're passionate about it too. We want to fight a disease that doesn't get a lot of publicity, doesn't get a lot of funding. So that's why foundations like the HEs have started. What one person can do, like we've heard from Dr. Alber and other people, it's amazing what this small group can accomplish for hopefully a cure one day, or much better treatments, which we see every year. We come up with something we're interested in and developing. So thank you all for being here, and hand it over to you.
So sweet. What an experience this has been. For me, it's just, I'm a caregiver too, and that's what got me into this world of Leiomyosarcoma, and I vowed that I was going to dedicate myself to being a good caregiver and to other patients and their caregivers, because it's important to do, because we're all in this together. And if we don't stay resilient and strong and have hope and courage that our researchers and our clinicians bring us, where will we be? And if it wasn't for them, they're our lifeline of hope and treatment. And we have to stand behind them, because if we don't, who's going to? And we have to just stick this out together. And I'm glad you're here. It was heartwarming to get your calls for registration. It's heartwarming to meet you. And I hope that we stay connected, because it's important. And I want to thank Sandra, Mijin, Dr. Singh for letting us come and be with you, because this was just a tremendous program. And we can't thank you enough for sharing your Saturday away from your families to be with us, to share what we need to know as fast as we need to know so that we can be self-advocates when we go to the doctor and we have better questions to ask. And I just thank you all very, very much, and I hope you have a nice lunch, and I hope you get to meet each other. Thank you for coming, and hopefully we'll see you in 2 years.